The federal government is not resting on its oars despite the global acclaim that trailed Nigeria's response to COVID-19. Participants at this summit agreed that the pandemic has been a wake-up call for policymakers at the federal and subnational levels to elevate healthcare delivery in the country.
The collaboration between the federal government and the states, because that is the only way you can maintain sustainability. That is the only way. And we need to pull the strings of our boots and hit the road and hit it really rough and fast to be able to push these vaccines. Because this is a smart virus. It will continue to mutate as long as we remain unvaccinated. That's the danger about it.
The coronavirus spread has shown that healthcare is the main power that shapes the economy and politics.
The summit identified research as a critical area that requires capacity building.
Not that COVID doesn't kill us, but it doesn't kill us as much as it kills people in the northern hemisphere. So if we can understand the pathophysiology of COVID in this environment, then we can find some biological markers. Once you find that biological marker, then you can use that to perhaps develop a vaccine or a therapeutic agent.
And that's the way to go. You can see that we have vaccine shortages in Africa. Why? Because we don't have indigenous manufacturing.
There is need for Nigeria to build on the very, very exceptional work that has been done by the Presidential Steering Committee to create a more formidable healthcare system that will be resilient enough to address any pandemic or epidemic in the nearest future. So preparedness is the takeaway.
To put the preventive mechanisms so that we can be able to curtail the spread.
This summit comes to a close, but the COVID-19 pandemic is still raging. State governments are urged to counter vaccine hesitancy with greater advocacy. In Abuja, Mitaire Ikben, NTA News.